Metastatic breast cancer is the most serious form of the disease and occurs when the cancer is spread beyond the breast to other parts of the body, such as the brain, bones, or liver. With many different treatments available, how should doctors and patients decide on the best course of treatment? Joining us now is the Assistant Director of the Breast Cancer Research Institute program at Sarah Cannon Research Institute, Dr. Denise Yardley, and Sue Friedman, Executive Director and founder of Facing Our Risk of Cancer Empowered. Sue, let me start with you. What does a diagnosis of MBC mean for a patient, and what questions should patients ask their doctors about their treatment plan?
Diagnosis of metastatic breast cancer can be devastating for patients and their families and loved ones. And in the United States, metastatic breast cancer takes a life about every 12 minutes. When faced with incurable disease, the hope for many people with metastatic breast cancer is to live as long and as well as possible. When discussing treatment, patients should ask questions and have an open conversation with their healthcare providers, asking what tests were ordered, what were the results, what do they mean for me? Are there any other tests that can help me make a decision? And it's important to let healthcare professionals know if you don't understand the answers that they're giving you.
Very important advice. And Dr. Yardley, what is unique about the Kisqali survival data and what makes it significant for patients with MBC?
So it's the only CDK4/6 inhibitor, the class of drug that Kisqali belongs to, that has shown a meaningful overall survival benefit in 3 large randomized trials. And what this means for patients is that the average overall survival for these patients on Kisqali was over 5 years. So these patients can take this pill in combination with their hormone blocking therapy and expect to gain this meaningful extension of their life, and it's partnered with great quality of life side effects with lowering white count, some nausea, vomiting, constipation, diarrhea, or some fatigue. So patients can take this in the comfort of their home and expect to have an improvement in their overall survival as shown by the clinical trials.
Where can our viewers get more information?
They can look at a site, www.kisqali.com. They can do breastcancer.org, cancer.net, or cancernetwork.org. These are all great sites that have meaningful information. And always I have the patients go to their healthcare provider to see if these options are appropriate for them.
Dr. Yardley, Sue, thank you both for joining us. We'll be sure to also post this information on our website at DailyFlashShow.com.